There are other things that can cause difficulty in weight loss. One of those things is food sensitivities or food allergies. So we offer a test called the Alcat test, and it's a food sensitivity test. Food sensitivities versus food allergies are an interesting topic because there are really two schools of thought. There's the food allergy, which is an immediate response, which is going to be kind of like your throat closing, your lips swelling, getting very itchy, very agitated, mood swings, things like that. That requires actual complete removal of those foods, avoidance, maybe even carrying around an EpiPen. An allergy is exactly what you would anticipate an allergy would be. But a food sensitivity is different because it creates this chronic state of inflammation. It's a completely different response in the body that's very low grade that we grow to learn and consider it normal. So if someone says, well, I always bloat when I have pasta, or I always feel a little uncomfortable after I eat popcorn, or I feel very tired every time I eat cantaloupe. Those are things that we consider it's normal because we're used to it, we expect it, we identify with it when it happens and we move on. When in reality, those are most likely food sensitivities, and we're creating antibodies against those foods, and they're causing problems for us. So we need to remove those for a specific amount of time. A very severe sensitivity would require about 9 months, maybe even a year of removal from our diet. Other times, if it's a moderate or a mild intolerance, we can take it out for 6 months or 3 months and then reintroduce it, once every week or every 4 days or something like that, depending on the individual and that individual's response. The Alcat test is a blood test. We send it to a lab. It comes back with a beautifully colored multi-page report that identifies not just the food sensitivities but also mold sensitivities, food dye sensitivities, certain medication sensitivities, even functional foods, herbs, and certain nutrients sensitivities. Things like gluten sensitivity is a big one in the media today. And what we've seen, it's a very real sensitivity. People say, well, everyone was able to eat gluten 40 years ago and nobody said anything about it. Well, things have changed and people have changed and our food has changed. And realistically, we need to adapt to those changes. And if we're finding difficulty in, let's say, losing weight, or if we're finding difficulty in paying attention, or if we're finding difficulty in sleep, or having energy throughout the day, very likely there are some food sensitivities that that people are continually exposing themselves to, and that type of exposure can create a whole world of problems that we don't realize are true problems. When it becomes a true problem is when it becomes chronic, and when it becomes affecting our body's ability to regulate hormone control, or to regulate sleep, or to regulate our own weight. You'll see examples of this in people who, work out all the time. They're at the gym an hour every day and they eat right, as they say, but they don't not only not lose a pound, their body actually doesn't change. And we have to identify with the nutrients that we put in our body and identify with the type of exercise and type of lifestyle that we do, and it all kind of has to work in one harmonious effort in order to get the results that most people are looking for. There's a very big difference between a lifestyle approach to medicine and a therapeutic approach to medicine. You can have a therapeutic lifestyle, and that's going to take a very long time to achieve your goal. But you can also have a very short stint of therapeutic effort, achieve your goal, and then use a new lifestyle as your maintenance in order to stay there and create a new normal for yourself. And we work on both sides. It all depends on the person.